Hi viewers, this video will be discussing about care of patient with Plaster of Paris, that is called as the POP or cast. I am Dr. Kavita, Professor, Madras Medical Mission, College of Nursing. The main objectives of this video, at the end of this video, students will be able to list the functions of POP, understands various materials available for application of the cast or POP, list different types of cast or POP based on the body part that it is being applied, list the articles used for application of POP, and discuss the application of POP, explains the process of drying POP, and cares patients with POP, and they will also discuss the do's and don'ts with POP, and at last they'll be able to assist in removal of POP and identifies potential complications of POP among patients. Let us have a small introduction about the POP. Whenever we say the word cast or POP, it is a rigid external immobilizing device that is molded to cover the shape of the body or contour of the body. And this cast or POP is a temporary circumferential immobilization device, and this is commonly used treatment modality following the closed reduction of fracture or to correct any deformity or to immobilize the body part. Mainly, this POP allows the patient to perform many normal activities of their daily living without much interruptions, while providing sufficient immobilization to the part of the body that it is being applied, so that the stability of the body part will be ensured with POP. Let us see the different functions of the cast. Cast generally incorporates the joints above or below a fracture or a deformity. Whenever we use this cast for immobilization, it can be used as to support or to protect a part of the musculoskeletal system during the healing process. And this cast also can be used to prevent or correct any deformity of the musculoskeletal system. And it can be used to relieve pain associated with the fracture of bone by immobilizing the part of the body. And it maintains a particular position and enforces the rest to the part of the body. These are the different functions of the cast. There are different materials that is being available to apply the cast. That is, the traditional one is the Plaster of Paris. Next is the fiberglass, and third one is the hybrid material, or we call it as the thermoplastics. So first we'll discuss about the Plaster of Paris. When we look into the composition of Plaster of Paris, it is otherwise known as the gypsum plaster, or it is made up of the calcium sulfate hydrated. And chemically, this is called as calcium sulfate hemihydrates, and this is in white in color and powder form, which is being slightly hydrated calcium sulfate, and usually it produces the heat using the gypsum. And this Plaster of Paris is the material of choice for primary casting, and this can be moldable, and this is economic and very familiar to orthopedic surgeons. And it is also easy to reinforce and remove. Rarely it causes the skin irritation, and it is not water resistant. It easily becomes wet. At the same time, it is very heavy over the body part. Sometimes it may break around a walking heel when especially used in the leg. It takes 1 to 3 days to dry completely. At the same time, it is difficult to repair when it becomes wet or it is broken. The next material is the fiberglass, and this fiberglass is very lighter in weight comparing with the plaster of Paris. And it dries within 20 to 30 minutes, very fast in drying. Compared with the POP, this fiberglass material is water resistant, and same time it provides adequate strength and durability, same like POP, and this is easy to apply and no need to remove during the radiographic procedures. And but it is more expensive in cost per roll. It is considered less moldable than the plaster, and it cannot be reheated and remolded. Sometimes patient may become allergic to this fiberglass. This fiberglass is the synthetic cast that is available in the market. And the third one is the thermoplastics. And these thermoplastics are more comfortable, lightweight, stronger, and very durable in nature. This can be easily removed and reapplied by maintaining the position of the body part, and same immobility it provides like POP. And these thermoplastics are more water resistant, and this is permeable. So the radiographics can be taken with this thermoplastics. It can be reheated for additional molding even after a period of time the patient is wearing this thermoplastics, which do not require padding like POP. When we apply the POP, we need to apply the padding. Over that padding only we can apply the POP. Whereas the thermoplastics can be applied directly over the body part. But one disadvantage is this is not as comfortable as plaster or fiberglass, but cost is very higher. Next, we look into the different types of cast or POP based on the body part that is being applied. The first one is the short arm cast. The short arm cast is the one which is extending from below the elbow to the palmar crease, which secures around the base of the thumb. If the thumb is included in application of this short arm cast, then that is called as the thumb spica cast. Next is the long arm cast. Long arm cast is the one which extends from the axillary fold to the proximal palmar crease. The elbow is usually immobilized at a right angle in this cast. Next is the short leg cast. The short leg cast extends from below the knee to the base of the toes. The foot is flexed in this position, which is in the right angle in a neutral position. Next is the long leg cylinder cast, which is being usually applied above the knee, that is over the femoral region till the malleolar region. Then that is called as the leg cylinder cast. It looks like the cylinder in shape. Next type of cast is the long leg cast, which extends from the junction of the upper and middle thigh to the base of the toes. The knee may be slightly flexed in case of the long leg cast. Next is the body cast, and this body cast or spica cast has three different types. That is unilateral hip spica cast, one of hip spica cast, bilateral long leg spica cast. This body cast or spica cast usually encircles the trunk and extends into the leg. If there is only one leg is covered along with the hip, then that is called as the unilateral hip spica cast. In case the trunk, one full leg and half of the another leg is covered with the POP, then that is called the one and a half hip spica cast. The third spica cast is the bilateral long leg hip spica cast, where it covers the trunk, then also encircles both the leg. Then we call it as the bilateral long leg hip spica cast. These are the different types of cast based on the body part that it covers. Next, we look into the articles that are required for application of the plaster cast. The first article or the material that is required is the plaster of Paris or gypsum salt. Plaster of Paris is soft and malleable when moistened with water, but it becomes very hard and durable after drying. Plaster of Paris is chalky white powder made by a process that removes water from gypsum. And this POP is available as individual rolls of pre-cut crinoline in various sizes, which is being impregnated with plaster. The rolls of bandages are dipped in water and applied smoothly to part of the body. The next is the crystallization. That is, with this POP, the crystallization is the process that occurs after application, and during this crystallization, heat is produced. Then it is exposed to air for drying up. It cools down after 15 to 20 minutes, and total drying takes up to 24 to 72 hours, depending on the body surface area it covers. Since this POP is producing the heat, it cannot be applied directly over the body part. Hence, we use the Stockinette before applying the POP. Stockinette is a soft material which is in tubular form, which is similar like footless stocking without the seams, and it is available in rolls of various widths, usually 5 to 40 centimeter. And this can be used to cover the part of the body before application of the POP. It protects the skin under the plaster cast and form a lining for the cast. Stockinettes also helpful to protect the edges of the plaster of Paris after application. The third thing is padding. An adequate padding with the cotton is necessary to protect the skin and bony prominences under the plaster cast. Padding is applied directly over the skin or over a covering of stockinette. This padding can be applied and it becomes very smooth and it does not produce any wrinkles. So it makes it easier for the application of the POP. The next thing what we require for application of POP is the warm water. Water should be kept at the temperature of 35 to 45 degrees Celsius to make it necessary to saturate the plaster bandages. The next is the special tables. We call it as the orthopedic tables. These are used for application of the cast. It has devices to support the uncasted area, leaving the area on which the cast is applied left free. Next, we'll see how to prepare the patient and the articles. First, we need to explain procedure to the client prior to the application of the cast. What is the purpose that the cast is being applied? How long it has to be kept? How to dry the cast? How to take care of the cast after its application so that the patient becomes very comfortable. And we also need to explain them at the time of application of the cast. The drying cast will produce the heat which will disappear after cast is dry. And we need to prepare the part of the body part for the application of the plaster cast. Clean the skin with soap and water and dry the area thoroughly and shave the hairy part to prevent bad odor. Examine the skin thoroughly for any lesions, infections, dirt and foreign particles which need to be taken care before application of the POP. Check and mark the area where the pulse was felt with a skin pencil for future references to assess the neurovascular assessment when the patient is having the POP. To learn about the neurovascular assessment, we can refer the previous video which is being posted. Protect the floor and garments of the clients and the operator from plaster that may spill during the application. Protect the skin area to be casted with the stockinette and cotton padding to prevent skin irritation and skin damage. Prepare the client as for the general anesthesia if reduction of fractured bones are to be carried out under general anesthesia prior to the application of the POP. Sometimes physician may perform the closed reduction of the fractured area before application of the POP. In that sense, then we have to prepare the patient for general anesthesia. Then all the articles need to be arranged in the plaster room according to the convenience of the doctor and the nurses, so that the working will become very, very easier. Next, we'll see the methods or steps in application of the plaster cast. Always maintain the position of the client as decided by the person who is applying the cast. First, cover the skin with the stockinette or web roll or padding without any wrinkles. If there is any wrinkles, that may lead to the skin breakdown and causing the skin ulcer. Cut stockinette longer than the expected finished length of the cast, so that the excess portion can be pulled back to cover exposed ends of the cast, which will make the cast end smoother and also it avoids the friction. Plaster filled bandages are submerged in the bucket of warm water one at a time. The excess water will be removed and the bandage is applied by encircling the body part. During cast application, support the extremity from underneath using the palms of hands in such a way that pressure is not applied to any area. Then apply cast using bandaging techniques. Do not press fingertips into the cast or rest the cast on the hard surface or the sharp area to avoid indentations or flattening of the cast, which will give rise to the skin breakdown or pressure over the area, leading into some of the complications. These complications we will look into at the end of this video. As soon as the cast procedure is over, patient's skin is cleaned off excess casting material before it dries. An X-ray may be performed to verify the correct bony alignment if close reduction was performed. Here, as a nurses, we need to remember one important point. That is, after application of the POP, never empty the plaster laden water into an ordinary sink, because this plaster sediments will solidify and plug the plumbing of the sink, and we need to take the extra care during this process. Next, we'll look into the drying cast. This is the important care that the nurses should understand after application of the cast or POP. Because once after applying the POP, the patients will be with the nurses. So we need to understand how this cast is getting dried, what is the process, and how to take care of the patient. A plaster cast becomes firm, that we call it as the setting of the cast. The sets takes place very rapidly, but it takes longer time to dry. During the setting period, there should be no movement of the body part. If there is any movement, that may produce a crack in the cast and make the cast weak. The cast will not serve its purpose. A newly set plaster cast is called as the green cast. There are various factors that will influence the setting of the cast. Some of these factors are the type of the plaster that is being used, that is using the fiberglass or the gypsum cast. The thickness of the cast, that is the layers that is being taken to apply the cast. And the condition of the surrounding environment, the ventilation of the area where the patient is there, then the temperature of the water used for application of the cast. These are the few factors that greatly influence the setting of the cast. So we need to think of these factors when drying the cast. A freshly applied cast should be exposed to circulating air to dry and should not be covered with clothing or bed linen or placed on the plastic coated mats or the bedding. If this is being done, there will be indentations in the cast that may give rise to pressure over the muscles that is there under the cast. A wet plaster cast appears dull and gray, sounds dull on percussion. So this is the assessment we need to do to understand whether the cast is dried completely or not. This wet or setting cast will also feel damp and smells musty. Next, we'll see how to take care of the client in plaster cast. Once the cast is being set and it is dried completely, we need to remember some of the points in taking care of the plaster cast. The patient is admitted in the hospital, we need to carefully do these things. Suppose the patient is getting discharged with the POP, we need to teach these points to the patient. If available, the written material, that is a pamphlet or the leaflets, can be given to the patient. These points are: a wet plaster cast must be handled with the greatest care to avoid the indentations over the cast. Always keep the casted extremity elevated. Allow the cast to dry. Usually the POP will take 24 to 48 hours. Sometimes it may take up to 72 hours to completely dry. In case of the synthetic cast, which will dry very fast within 20 minutes. A cast should not rest on the hot surface while drying. Place supportive pillows along the entire length of the casted area during this drying process. So the part of the body will be completely supported with the pillow. As soon as the cast is complete, the client's skin is cleaned to remove the excess of plaster. Handle the wet cast with the palms until dry. Never use the fingers to handle the cast. And assess the color of the dried cast, which will be very shiny and white in color. Usually this freshly applied cast should be exposed to the circulating air to dry. Never use the dryer for drying the cast. Wet plaster cast appears dull and grey, sounds dull on percussion, feels damp and smells musty. Watch for swelling below the plaster cast. If there is any swelling, a windowing can be done over the cast, or the cast can be assessed. Assess the neurovascular assessment if there is any swelling below the plaster. As soon as the plaster is completed, check the distal pulse. Mark the pulse with the skin pencil so that it can be used for the future references. Cutting or bivalving the cast is required if there is circulatory impairment. That is cutting or bivalving the cast, exposing only the impaired circulatory part, or if there is any wound or swelling or infection, those parts alone can be cut or bivalved. And edges of the cast can be petalled, that is smoothing the edges of the cast. Monitor the patient's temperature. Observe for foul odor, which indicates the infection, or if there is any drainage. And if there is any drainage, circle the area on the cast so that we will know if there is continuous drainage, the circle will get extended. It is also important that a cast is not heated with an artificial method, because the outer side of the cast will be dried soon with the heat applied, but the inner side will remain damp and can cause cracks in the cast. Monitor the warmth of the cast. Monitor the wet spots which require drying or drainage under the cast. So if there is any wet spots, we need to be careful in observing the wetness. If there is any open drainage present as shown in the previous picture, keep a window and bivalve the cast. Teach the patient to keep the cast clean and dry, never wet the POP. And we need to teach isometric exercises to the patient, hence the muscle atrophy can be prevented. Points that need to be taught to the patient. Avoid resting cast on hard surfaces or sharp edges that may cause indentation or dent the cast, causing the pressure areas. Never use a coat hanger or other foreign object to scratch inside the cast. This may cause skin damage and infection. Many times, patients wearing the cast will feel itchy sensations inside the part of the body over the cast is applied. So the patients have the intention of scratching the area using the pencil or coat hanger or comb or pen, something which is weak, which can be used, but that can be avoided. We need to teach the patient not to scratch inside the cast, because when we scratch, there can be skin breakdown, which can cause the pressure ulcers. Teach the patient to report any danger signs to the nursing staff immediately. That is pressure spots, odor, or feeling that the cast has become too tight. This may indicate of the impending complications. Report any damage to the cast, such as cracks, breaks, or soft spots. Never attempt to remove or alter the cast. And we also need to teach certain do's to the patient. That is, make sure to keep the cast dry, wrap the cast with the plastic cover while bathing to avoid wetting the cast. Patient can be advised to elevate the extremity above the heart level. Exercise the joints distal to the cast. Certain exercises can be taught to the patient. Keep the cast away from heat. These are the do's that we need to teach the patient. At the same time, there are certain don'ts which the patient should never attempt to do it. And teach the patient not to insert any objects inside the cast for scratching the skin. Don't pull or cut padding from inside the cast. Don't drive or lift anything heavy using the casted extremity. Don't bump or jump on any hard surface which will damage and alter the contour of the cast. This is about the application, drying, and care of the patient or care of the body part with the cast. Once the patient is wearing the cast for a prescribed period of time, then the cast has to be removed. So the cast removal or POP removal also is important responsibility of the nurses need to understand. So let us discuss about the cast removal. Cast removal is a procedure that is done by the qualified and experienced medical personnel, because this procedure involves the risk of injury to the patient and it should be done with the utmost care. There are certain important things that need to be kept ready for cast removal. These are the scissors that is used to cut the bandages, a spreader once the cast is being cut, and the electric cutter to cut the cast. So certain general guidelines for removal of plaster cast are: we need to teach the patient the noise of the electric cutter sometimes frightens the patient. So shears may be used if the patient is frightened of the cutters. The procedure need to be explained to the patient. The apparatus that is being used to cut the cast can be demonstrated to make them feel at ease. The cast should be cut steadily and smoothly. The limb in plaster should be supported by the sandbag. Suppose if the lower limb cast is removed, then the patient can be lying on the side-like position. If the upper limb cast, then the patient can sit or lie down comfortably. And the patient is covered with the linen and position the patient's limb appropriately and easy to remove the cast. And assure the patient that the procedure will be safe and the electric saw does not cut the skin, since it vibrates, it doesn't cut. It cuts the POP by vibration only. A plastic skin protector strip can be inserted into the cast lining and the patient's limb in the area if it is required. And care of the part after cast removal. Once the cast is being removed, carefully examine and inspect the limb for any signs of trauma inflicted during the removal procedure. And instruct the following to the patient, which includes wash and dry the part, because once the patient is wearing the cast for a longer period of time, the skin will become very dry. So we need to wash and dry the part carefully. Gently massage the skin with oil or cream, which may help to restore the normal nutrition elasticity of the skin. Sometimes the patient may experience a kind of swelling over the limb after the period of immobilization, especially the lower limbs. In that sense, reassure the patient that within few days that the swelling will come down. Ask the patient to continue to perform the range of motion exercises that is being done to the patient. If there is excessive swelling, that can be managed by elastic wrapping or intermittent limb elevation. Encourage the patient to resume normal activities gradually to rest the part at regular intervals. During the rest period, we can teach the patient to perform digital exercises like moving the fingers or toes, so that will improve the venous return, help to reduce the swelling. And muscle strengthening exercises can be done to regain the muscle function. There are certain potential complications that is being expected or need to be monitored when the patient is wearing the plaster of Paris. When the cast is applied too tightly, or if there is any swelling which is constricting the body part, then the patient may develop the impaired blood flow, nerve damage, or tissue necrosis. If there is any open infection wound, then that may turn into the infections. The next complication is the Walkman's ischemic contracture, and this is actually the muscle contracture over the part of the body that is being covered with the cast, which is applied too tightly. The part will become very rigid, which will further impair the function of the part. The next is the cast syndrome. This cast syndrome is usually expected when the body spica or hip spica is applied, and because there will be a gastric dilatation with the partial or complete obstruction of the duodenum because of the too tight application of the body spica. The next complication is all the complications that is being expected of the mobility can be also expected when the patient is applied with the POP, like impairment of circulation, skin breakdown, etc. The last but very dangerous complication is the compartment syndrome, and this is a painful condition which is caused by the pressure which is being built up from the internal bleeding or swelling of the tissues, where the pressure which will decrease the blood flow, deprive the muscles and nerves of the required nourishment, and this is very, very dangerous condition that is need to be monitored. These are some of the potential complications of the POP application. Just to recap it, the complication: the too tightly applied cast may impair the blood flow, cause the nerve damage, and tissue necrosis and infections with the open wound, Walkman's ischemic contracture, cast syndrome, and complications of immobility, compartment syndrome. And some of the take-home messages with this: cast application is the process which is being usually done by the trained medical personnel, but nurses have a very, very important role to make the patient comfortable before application of the cast, help the patient during the process of setting or drying the cast, and teach the salient features that the patient need to do and not to do when applying the cast, and monitor for the complications. The main thing that need to be monitored during POP application is the neurovascular assessment. You can refer the previous video which is being detailedly explained with the neurovascular assessment. And these are some of the references that is being made to prepare this video. Thank you.